for the north of India.
Okay, Prabhu, you can just share the link of the YouTube on the chat box,
Okay,
so
sir.
that everybody can copy it and share it across.
Yeah, 2 minutes I'll share, sir.
Yeah.
Sir, I've shared the link on YouTube. Everyone can
So
see.
everybody just copy the link on the chat box and you can just share it across. And Prabhu, also make Bala the co-host.
Yeah, I've done it, sir. I've done it.
Yeah.
310.
Shankarji, it looks like you're telling a T20 score.
Sir, I've shared the link on YouTube.
T50 score.
Everybody just copy the link on the chat box and you can just share. And Prabhu, also make Bala the co-host. Okay. Another 5 minutes, we will start.
310.
Shankarji, it looks like you're telling a T20 score.
Sir, I've shared the link on YouTube.
T50 score.
Everybody just copy the link on the chat box.
Sir, I'll just mute everyone so that we won't have the voice leaking. I've muted everyone. Whoever wants to speak, they can unmute themselves.
Okay, Sharat sir, maybe can I just start off with a welcome? Sharat sir.
Yeah, please.
Okay.
Please go ahead.
Good evening and welcome you all to this wonderful evening. We would start the meeting in few minutes and now is the time to meet and greet everyone. This is Naga and I also have Sujata from the MC desk, welcoming you all to the event. Request everyone to be in the mute mode. We would start the meeting in next 5 minutes.
Sharat, just to let you know, I've also shared the YouTube link on our Rotary Action Group for Facebook page, so it's live there as well.
Okay, ma'am. Thank you. Thanks a lot. Yeah, Naresh ji, another 2 minutes to go. Yeah, unmute yourself.
The intro video today, Prabhu is sharing.
Okay. Okay, the co-presidents can keep their callers ready so that when the MC asks the presidents to caller themselves, you all can do that. And if you're on video, we can spotlight you. I wish every school and college is so silent.
Then what's the fun?
At last, somebody is speaking. Generally, people create so much of noise in a Zoom meeting. It is so absolutely pin drop silence.
Good evening,
course.
Sarabhai. Good evening. I am Anurag Mittal from District 3100. Good evening to all.
Yeah, Anurag ji, good evening. Good evening.
How are
Sharad,
you?
just to add, it's again with more of women. Surprising, it's so silent.
Hi, sir.
No,
Yeah.
that's the comment. We have to.
We are here to break the silence, Sharad.
Said that.
Yes, yes, yes. Whatever the woman says is always right.
That's why the men
It's 5:25. We'll start the
President, with your
meeting.
permission, good to go 5:25.
Yes, yes.
Okay.
Prabhu?
Yeah. So
Sarath, always they will
we're gonna
speak,
start
we
off.
only listen, no?
Yeah.
Over to the MC now. Over to the MC now.
Thank you. Thank you. So, Joy of Giving is our club's theme for this Rotary here. Inspired by Mother Teresa's quote, it's not how much you're giving, but how much love you put into your giving. Also, let us meet the members of the most happening club in the Rotary world. Here is the presentation of the members of Rotary Club of Guindy. That's for the members' intro video.
இப்போ இதுக்கப்புறம் என்ன பண்ண முடியும்? இல்ல, how do you make it live? ஒன்னும் பிரச்சனை சான்ஸே இல்லையே. பேக்கப் சரி ஓகே. இப்பெல்லாம் டென்ஷன்.
Arey, it's muted.
Thank you, AV team. That was wonderful. Starting something new actually scares us. The most dangerous phrase that we have always heard is, we have always done it this way. There is nothing permanent except the change. Yes, healthy women means a healthy family. And women's health is everyone's health because a strong woman can conquer the impossible. Growth begins in a literal way. Hence, menstrual hygiene is key to a woman's health. Over to
Thank you,
you,
Naga.
Suja.
Thank you, Naga. That's a wonderful introductory hint about what is the forthcoming program. It's our pleasure to welcome all Rotarians, ants, retractors, interactors, ANNETs, inner wheel members, and members of all participating clubs across the district, and all the passionate participants of this meeting. I welcome you all for this unique and wonderful evening. We will begin this event with an invocation song. Over to Naresh.
எத்திசையும் புகழ் மணக்க இருந்த பெரும் தமிழனங்கே தமிழனங்கே உன் சீரிழமை திறம்பியந்த செயல் மறந்து வாழ்த்ததுமே வாழ்த்ததுமே வாழ்த்ததுமே.
We request President Rotary Club of Guindy, Rotarian Sharath, to collar himself. Also request other participating club presidents to collar themselves.
Yeah. Yeah, the other co-presidents can also collar themselves. And MC Nagalakshmi, you can unmute yourself.
Yes, we request other participating club presidents to collar themselves. Yeah, thank you. Over to you, Suja.
Suja, please unmute yourself.
I request President Sharath to call the meeting to order.
This meeting of Rotary Club of Guindy, along with more than 25 participating clubs on a very important topic, Menstrual Cup, is now called to order. Thank you.
Thank you, President. All Rotarians abide by this. I request Rotarian Radha of RCG to read the four-way test.
Thank you, Nagu. Very good evening, all. Rotarians worldwide follow this moral code of ethics, Rotary's four-way test for personal and business. It was scripted by Herbert J. Taylor, an American from Chicago, and it goes like this. Of the things we think, say, or do, is it the truth? Is it fair to all concerned? Will it build goodwill and better friendship? Will it be beneficial to all concerned? And if I relate this to this session of Menstrual Cup awareness, is it the truth? Yes. Is it fair to all concerned? Absolutely. Will it build goodwill and better friendship? Of course. Will it be beneficial to all concerned for better health and greener India? Thank you so much.
Thank you, Rotarian Radha. You read it with your own style. Now I call out Anne Rajalakshmi to come and share her thought for the day.
Good evening. Are you able to hear me?
Yes, perfect.
Okay, fine then. Today's topic is a very relevant topic, and my thought for the day is so relevant to this particular topic. The world is asleep to the understanding of the menstrual cycle. It is the cycle of the rebirth of women. Celebrated. Thank you.
Thanks, Raji, for the wonderful thought. I would like to appreciate our President, Rotarian Sharad, for organizing this meet. This is such a unique meeting. Thank you, sir. Thanks for getting this meeting for all of us. I would request President Sharad to welcome the gathering.
Friends, very good evening on a Saturday afternoon, and thank you everyone for making into this Zoom meeting. Now it looks like we are going to be in virtual for some more time. Our club had a 6 months interval where we hosted a lot of in-person physical meets, and we had our fantastic GOV the last Saturday, which is on 10th of April. Thank you, everyone. And I thank all the participating clubs. More than 25 clubs, we have put all the names. The MCs would recognize all the club names. And apart from that, in the last minute, a lot of club presidents had called up and they said they would also participate. Thank you very much. It has been a great response because the topic is a very, very relevant topic. And honestly, I didn't know there is something called a menstrual cup until the meeting was going to be organized. Thank you to the club service director and the chairman for organizing this meet, and thank you all the doctors, and thank you all the co-presidents, Rotarians of all the participating clubs, the special guests, and Rotractors, Interactors, Annettes, Inner Wheelers, and friends and families all across. Thank you very much. Now, over to MC.
Thank you, Sharad. I request our wonderful First Lady Nandini to say a few words to welcome the passionate participants of this meeting.
Thank you, Naga. Good evening and welcome a wonderful gathering of Rotarians and their families, inner wheelers, family, annex, interactors, rotaractors, and families, friends. What a wonderful platform to address such a great audience on such an important topic. Let's welcome. An eco-friendly alternative to the sanitary pads that most of us use. Sit back and hear the most best doctors what they have to say. I am sure you will find this program very useful. Thank you.
Thank you, President. Thank you, First Lady. It will be appropriate to call AG Rotarian Vidya Srinivasan to set the tone for this event, as she is the one who holds a position of Vice Chairman of Rotary Action Group for Menstrual Health and Hygiene. I request Rotarian Vidya Srinivasan to set the tone of the event.
Can you hear me?
Yeah, perfect.
Yes.
Are you able to hear me, please? Yes?
Yes. Perfect.
Yeah. Very good evening to the T20 presidents and Kamala, our esteemed panel of doctors, Dr. Raj Maheshwari, Pavitra, and our crusader with the cup, Dr. Meenakshi Bharat, and all the dignitaries present here today, and the Rotarians who have gathered across from India and also the world over. Thank you, President Sharad and Anne Nandini, for bringing together so many clubs to break the silence on this topic of menstrual hygiene. I saw a chat question, is RCG an all-male club? So kudos to the project chair, Dr. Anu, and club services, Kritika Madhu, for the proactiveness and for the many deliberations to make this program a reality amidst this crazy COVID uncertainty. Menstrual hygiene management is a globally recognized public health challenge. Rotary International has been quick to recognize this, and the Rotary Board has formally approved this Menstrual Health and Hygiene RAG in the March of 2021. And I'm so glad to see Sharmila, who is the chair for it here. And menstrual health not only meets the 7 focus areas of Rotary, but it also helps government further the social and economic empowerment and growth of all nations. It can also contribute to achieving a number of sustainable development goals of the UN, which is quality education, gender equality, clean water and sanitation. Our country, if you look at India, is very confusing in many ways. The same society which celebrates women as goddesses, it also has this dichotomy in the way the society looks at menstruating women. On one hand, we have Manjal Neera to Viras, when a girl attains puberty. At the same time, you stigmatize everything which is, to do with menstruation, and it curbs any kind of open, honest, constructive conversation. It is not just about wash. Let me tell you, ladies and gentlemen, yes, access to water and sanitation is important and it's a critical component, but there are many issues to be addressed, be it the menstrual related shame and taboo or period poverty, a reality which is even in developed countries, and the all important universal issue of pollution due to the menstrual product waste. Right now, we have some interventions in place which are focusing merely on the technical solutions, which is access to water, to some extent provision of pads and other menstrual material. In today's session, we hope to break the silence and bring to the forefront some more important issues. One is the fact that it is beyond technicalities. Menstrual hygiene has a severe impact on women and girls' rights, dignity, and well-being. Her well-being is so crucial to your family and to the entire community. Just think about it. 23 million girls drop out of school when they reach puberty in India. Just imagine what is the impact of that on our country. One of the reasons is because of this is it leads to gender inequality, and unequal power relations between men and women is never going to be a peaceful world. Let me tell you that. It's everyone's problem. It is not about Pengal Samacharam, that's what we always say, Pengal Samacharam. 50% of the world's population is female, which means the other 50% is men. So you need to also wake up and be a part of this solution, I would say. I wouldn't say be part of the problem, but be part of the solution, because your husbands, your fathers, your brothers, your community leaders, entrepreneurs, right? So you need to help us build an environment which is open to facilitate conversation around it. Third, we all live in the same earth, men and women. The correct disposal of sanitary waste is so essential to everybody's health and well-being. So both men and women need to work together to build sustainable solutions to this problem. The first step being awareness. Today, you will learn some very shocking facts which we are so blind to. We just don't even think about it. We have an expert panel here today, the 3 doctors who are truly amazing, and you're going to take a lot of information today. And as Rotarians, we need to band together and we need to take some urgent action on these issues, such as advocacy and policy changes. Both our RIP elect Shekhar Mehta and our own RID elect A.S. Venkatesh have pledged support, as have many of the board members in their interactions with us. We have a great visionary leader for 3232 in DG Muthu Palaniappan, who has already implemented many important projects through the Women Empowerment Team. It also helps us that there are there are 3 women in his house, starting with Anne Kamala and then his 2 daughters who are egging him on right at home. We have an amazing group of men and women who are part of the Rotary Action Group globally to help everybody here, right from formulating projects to effectively running them, global grants, whatever it takes. So make good use of all of us. I will conclude by urging every district leader here, every president here, to do a project, sustainable project and a sustained project, continuing project in menstrual hygiene year after year, and request to all the DGs here to have a chair for menstrual health and hygiene in your district and give it that importance that it desperately needs. And thank you once again, to the leadership of Rotary Club of Guindy. Let's all walk the talk together. It's all in your hands. Thank you so much.
Thank you, ma'am. I would like to recognize the presence of participating club and would like to thank the participating club presidents. We would like to thank Rotary Club of Chennai Silk City, President Dr. Alankar, Rotary Club of Chennai Rainbow, Rotarian Dr. A. Devakumar, Rotary Club of Chennai Prime, Rotarian R. Ravi Shankar, Rotary Club of Madras Kanimara, Rotarian A.F. Khan, Rotary Club of Chennai Mogappair, Rotarian T.V. Radhakrishnan, Rotary Club of Madras Temple City, Rotarian A. Venkatachalam, Rotary Club of Madras Silver Beach, Rotarian Devi Avila Westcourt, Rotary Club of Pune Kalyani Nagar, Rotarian Megha Sharma. Thank you.
Yeah, MC, just a word. So somebody was saying that it's an all male club. Okay, so we have 6 wonderful Rotarians. Those 6 wonderful Rotarians are equal to the 100 male Rotarians of our club. That's it. Over to MC.
Over to you, Suja.
Unmute, Sujata.
Now, this is a time to brighten up the evening with a speech of our guests. Now, I call upon Anne J. Sujata to introduce our honorable guest, Dr. Raja Maheshwari. Is it audible?
Ma'am, you need to unmute, ma'am.
Good evening, everybody. It is indeed a privilege to introduce former Professor Dr. N. Raja Maheshwari, MD, DGO, MCH Urology. With her qualifications, she is a trained urologist and gynecologist, practicing as a consultant urogynecologist for the last 3 decades in India. Her international training includes Commonwealth Fellowship from UK and further training in USA, Germany, Belgium, South Korea, and Australia. She established a urogynecology specialty in India and is a former professor and HOD of Department of Urogynecology at Government Kasturba Gandhi Hospital and Madras Medical College in Chennai, India. The majority of her surgical practice involves reconstruction of urinogenital tract for POP, autologous slings for SUI, correction of urinogenital malformation, and urinary fistula repair. She regularly trains gynecologists and urologists in prevention, recognition, and surgical repair of fistula cases. She has a long list of specialists, both national and international, waiting to undergo training under her. Currently, she's serving through Urogynecology Research Center in Chennai, which exclusively serves women who have pelvic floor dysfunction. She's a visiting surgeon and urogynecologist of the Ministry of UAE. She's a certified trainer of prevention and repair of perineal trauma, episiotomy through coordinated training, also called Protect 2013. She is a president of Urogynecology and Reconstructive Pelvic Surgery Society of India, a registered national society which was established in 2005 and got affiliated to International Urogynecological Association in 2008. Dr. Raja Maheshwari's academic services include her being in the editorial board of many journals and a member of many international committees of urogynecology. She has conducted several training programs for urology specialists in urogynecology. She has conducted lectures extensively at conferences all over the world, specifically Jakarta, Boston, Myanmar, Cape Town, Malaysia, Dublin, France, Singapore, Australia, Texas, Taipei, and Buenos Aires. With so many achievements to her credit, it goes without saying that Dr. Raja Maheshwari has won an impressive collection of national honors. She is a recipient of the Honorary Fellow of Indian Academy of Obstetrics and Gynecology, AIAOG, December 2018. The Superheroes Award in recognition of lifelong commitment, meritorious services, and distinguished contributions to the causes of women health empowerment, upliftment, and rights by the Federation of Obstetric and Gynecological Society of India, FOXY for short, in 2019 at Coimbatore. The National Award, Mother Teresa Award by the Central Government Women Employees Welfare Association 2014. She was honored with Lifetime Achievement Award and Best Doctor Award 2012-13 for recognition of services in the field of medical science by the Tamil Nadu Dr. MGR Medical University and Lions Club in 2012. She was honored with Kalpana Chawla Award 2009 for Courage and Daring Enterprise by the then Honorable Chief Minister of Tamil Nadu during the Independence Day celebrations in 2009. The Rotary International's highest award for the sake of honor was conferred honor in 2005 for the yeoman service rendered towards the poor women patients in India. She has many publications to her credit. She is author of a book named Urogynecology and Indian Focus. She has also edited and contributed her knowledge to several publications and textbooks. She has in addition published several surgical educational videos as DVDs on many related topics. Friends, the list seems endless. I could go on and on, but I'd rather stop now and let's have you, ma'am, doing the talking. Dr. Raja Maheshwari, please.
Hello. Thank you very much, Sujata, for your kind words. And good evening to everybody. I hope I'm audible to you.
Ma'am, perfect, perfect.
I just would like to know whether the screen share, you have the picture?
Yes, yes.
Do you see the picture?
Yeah, correct. It's visible.
Oh, okay. Fine, fine. Okay. So I'm just going to talk to you in brief about the urogynecological problems in women. Ladies and gentlemen, at the outset, I would like to appreciate and thank the organizers and members of the Rotary Club of Guindy and all other branches of Rotary. Thank you very much for initiating the program. And as a urogynecologist, what do? I deal with patients who have disorders and dysfunctions of genital tract and lower urinary tract. As you all know, this kidney, ureter, bladder, they constitute the urinary tract, and the uterus, cervix, vagina, and all the things, they contribute to the genital tract. So we deal with the problems that occur in the genital tract and also in the lower urinary tract. So when a female baby is born and it goes through various phases of life, say prepubertal phase, adolescence, reproductive phase, menopausal phase, and even past that, women are subjected to so many challenges in life. They are subjected to many shocks, surprises, and setback in their life. The most important one is the menarche, the onset of the first menstruation. Yes, that is the shock of our life, first time when you experience it. Still, in many places, it is considered as a taboo topic, and I'm glad that Rotary Club has come forward to make a change in this. So subsequently, during the pregnancy and during the childbirth, women know they encounter innumerable number of problems and challenges. Then finally comes what is called the menopause, the ultimate one. So ladies and gentlemen, in all these different phases, women do encounter different kinds of urogynecological problem, and it is beyond our scope to cover everything. But what I have planned is I'm just going to talk about few things. I'm just going to talk about one vaccination that is going to prevent against the cancer cervix, and I'm going to talk about 2 exercises that will help you to hold urine in day-to-day life. And I'm just going to talk about 3 clinical problems. Ladies and gentlemen, so what is this? Prevention against cancer, and let us see what it really matters to us. So the cancer cervix, you know, the uterus has the body and cervix or the mouth, you see. When there is cancer in this, it is called the cancer cervix. So this is the second most common cause of death due to cancer in women. It says more than 200 women die every day. 1 in 52 Indian women encounter this cancer cervix problem. Every 7 minutes, 1 Indian woman die because of the cancer. So why is this? If you look at these statistics, the overall almost 1/3 of all cancer cervix is contributed by India in the world population of cancer cervix patients. So ladies and gentlemen, why is it so? Because most of the time, just like any other cancer, this cancer also progresses silently, and there is a poor early recognition of the problem. That is the main reason which results in this kind of high mortality in our population. So it is true that every woman is at the risk of suffering from cancer cervix. Ladies and gentlemen, approximately 80% of women run a lifetime risk of acquiring the HPV, human papillomavirus infection. This is the high-risk oncogenic infection, HPV infection. It occurs even after a single intercourse, and the risk continues throughout the life of the sexually active woman. And there is a 46% cumulative risk of acquiring cervical HPV infection, even with one sexual partner, and usually it takes 3 years to manifest subsequently. There are a few facts like, is it preventable? Yes. It will be surprising for you to know, yes, this cancer is preventable. It is caused by the HPV, human papilloma virus. It spreads by sexual transmission. And pap smear is a very simple tool with which you can easily recognize in the early phases of the cancer. And the early stages of cancer, they have very good prognosis. And there is a vaccine which is effective in preventing it. Usually it is given prior to the sexual debut. Ladies and gentlemen, how to keep women free from cancer cervix? There are two ways. One is the vaccination, another is the periodical screening. So in the vaccination, there are vaccines available, 3 shots over the period of 6 months, recommended beyond the age of 11 years, though it is recommended from 11 to 25 or something like that, but it is approved from 9 years to up to 45 years. But usually the vaccine will be effective before the sexual activity begins in their life. Ladies and gentlemen, this vaccine prevents the HPV types, all these mentioned here, 6, 11, 16, 18, all those things, which induces diseases like cervical cancer, vulvar cancer, vaginal cancer, and also the precancerous dysplastic lesions and the genital warts and the infections. So it is recommended even for males in the age group of 9 to 21 in order to prevent the HPV associated warts and infection among men. Ladies and gentlemen, is it safe? Yes, this vaccine is safe and effective. You see that the World Health Organization, Food Drug Administration, CDC, all these organizations have declared it is safe and effective. What is the other means by which you can recognize the cancer early and offer a better prognosis for a victim? So what you can do is you can ask the woman to have a periodical, simple screening tool, screening test that is called the pap smear. So every 3 years or once in 5 years, we subject them for a pap smear as well as the HPV DNA test. And it is also recommended to use condom during sexual activity to reduce the chances of HPV infection. So ladies and gentlemen, we have the pap smear, we have the liquid-based cytology, and also the visual screening using the colposcope and other things in suspicious cases. So I really appreciate the effort of Rotary Club in all their activities in relation to the improving the quality of life of women and women's health. But at the same time, I also appeal to the Rotary Club to step in and to help the women. You can extend all the possible help from the Rotary to vaccinate the daughters and screen the mothers and to help in the fight against the cancer cervix in our country. Ladies and gentlemen, as a urogynecologist, what is the next thing that I see? Now, I normally handle women who have the pelvic floor dysfunction, urinary incontinence, and other things. I'm just going to touch upon 3 clinical problems. One is the pelvic organ prolapse. You all would have heard about from the grandmothers and the elders at home. Normally, you know, this is the bladder, this is the vagina cervix and the motion passage. All these are supported by the muscles, ligaments, and the tissues. And when these supporting structures get damaged, either by childbirth or by inherent weakness, then these pelvic organs come down beyond the body of the woman. Then that is called the pelvic organ prolapse. So in what way it causes problem? It feels like the woman feels there is something, a mass coming down, something like a bulge or like an egg, and there may be heaviness and pressure effects. And once it increases further, there can be difficulty in passing urine, passing motion, or even difficulty walking. So why would women develop prolapse? Normally, it is the damage which starts with pregnancy and continues, and the ultimate, the damage, everything happens with childbirth. And particularly delivery of big baby, difficult delivery, all those things. And the menopause, there is hormonal deficiency, which weakens the support. And those women who are obese with chronic constipation, chronic cough, all these women form a high risk. So the main culprit being the childbirth trauma and the damage. So there are, as women, we get two rewards out of childbirth. One is the prolapse, another is the urinary incontinence. You can see how the occurrence of prolapses increases with increased number of childbirth, but the urinary incontinence, even with one single delivery, the woman gets the damage, and it doesn't really increase further with the increase in the number of childbirth. So there are so many procedures, operative procedures, simple laparoscopic, robotic procedures, obliterative procedures are available, and certainly women can be cured of this problem, pelvic organ prolapse. The next problem is urinary incontinence. How common is incontinence? It is very, very common. It is twice more common among women compared to men, and particularly in elderly women. So it is not just leaking once in a month or something like that. Whenever there is a involuntary leakage of urine, which has social and hygienic consequences, then it deserves evaluation and treatment. So in a practical sense, if you take 3 women, 2 out of the 3 are likely to have urinary incontinence. You can call it even as a hidden epidemic. The risk factors, as I already told you, the same thing like prolapse, you have the parity, pregnancy, childbirth, and then other risk factors like obesity, all those things from the high risk. So it is not a life-endangering problem, but certainly it compromises the quality of life of a person. So neither they can live with it nor they die out of it. So it is very important for us to address these problems. So what I will do is just address few of it, the common issues like stress incontinence, urge incontinence, and mixed incontinence. What is this stress incontinence? It's nothing to do with mental stress. It is with physical exertion, like coughing, laughing, then there is urinary leakage. So it is often said that the laughter is the best medicine, but if this is going to cause leakage, no one would want to laugh even. So ladies and gentlemen, it doesn't mean only for a weightlifting champion this happens, not like that. Even with minimal exertion, like see day-to-day, coughing, laughing, lifting, even a baby, all these things, going to the gym, all these things can cause it. So how common is stress incontinence? If you take 4 women with urinary incontinence, 3 out of the 4 are likely to have stress urinary incontinence. If you look at the cause, again, the pregnancy, childbirth, multiple childbirth, repeated pelvic operations, and the high impact activities, constipation, chronic cough, all these things form risk factors. So how do we manage them? When the problem is mild, infrequent, and the woman has not completed her childbearing, or she refuses surgery, or she is unfit for surgery, and if the incontinence occurs after failure of operation, and if a woman has voiding problem. In all these cases, we recommend them to have the non-surgical modalities. Like we request them to lose weight, we just guide them to manage the fluid, and then we request them to do what is called the pelvic floor exercise. It is, some people, they call it a schedules exercise. So you can do the exercise with biofeedback or even without biofeedback. You can get the guidance using the vaginal combs or even electrical stimulation. But only thing is, it is not going to give a fast outcome like surgery. So the compliance declines over time, because unless you do the exercise for minimum 2 to 3 months, there may not be any improvement. On top of it, you need to continue the exercise lifelong, which is highly difficult for our people. So when the symptom progresses further, and to the extent that a woman has to wear a pad when she goes out or to manage her day-to-day activities, we offer them surgery. We have different types of sling operations available to help them. And what is important to consider is there is a mix-up of stress incontinence, urge incontinence, which is quite difficult for the patient to manage, because we need to know this urge incontinence is due to bladder problem and this stress incontinence is due to urethral problem. They have different etiology and deserve different type of management. And it is also worth remembering urinary incontinence is highly prevalent in women, but all the more it is worse as the age increases, and it is twice more in the elderly women. Ladies and gentlemen, the next one is called the overactive bladder, OAB. What is it? So the bladder is very sensitive, hypersensitive. The bladder contracts too early before it gets filled full. So it is also very, very common. It is much higher in women, and the women who have stress incontinence, more than 50% of them have this overactive bladder. So all these women, how do they present? They have increased frequency, urgency, urge incontinence, and nighttime increased frequency. So what is this frequency? Normal day-to-day frequency is 6 to 7. Nighttime, it's just once or less than that. If at any time it is more than that, it points out that there is some problem. So what is this urgency? Sudden, irresistible desire to pass urine. Most of the time, the women, they have to rush to the bathroom and they will wet themselves before even reaching the toilet. So you might have seen that most of the women, they sit cross-legged. The grandma's advice, keep your legs crossed. I used to wonder what is the reason. The one possible explanation being the cross-leg position helps you to hold the urine before it comes out. So what is the cause for overactive bladder? It can be myogenic or it can be neurogenic. So ladies and gentlemen, there can be obstruction, there can be a spinal cord trauma, or it can occur after a stroke, a cerebrovascular problem, or a spinal cord damage, or even Parkinson's disease, multiple sclerosis. All these conditions can cause the overactivity, and all these women will have frequency, urgency, urge incontinence, and there is treatment available. We have drugs, we have bladder training, and we have, in extreme cases, we use surgeries. So there is no need for you to keep quiet just being bothered by this overactive bladder. So it will definitely disturb your day-to-day activities. There are different types of medications available. So you need to choose the medicine that will help you. And there are incontinent special protection pads available. In extreme cases, we have the botulinum toxin intradetrusor injection and even surgical measure. What is the barrier to the treatment? It is too embarrassing to discuss, like the menstrual hygiene. We always think that it is part of it. Everyone will have it. There is no treatment treatment will not be of any use. All these things. I think one need to break the barrier to come out and avail the treatment. So if you use the correct medication and use the bladder training, urge suppression, definitely it will be helpful. Otherwise, most of us will be like this, needing a come out like this, and there is likely to be social ostracization. The last clinical problem is the urinary infection. And it is said there can never be a woman without experiencing the urinary tract infection symptoms in her lifetime. It is very, very common. It is what is this infection? It is establishment and multiplication of organism in the urinary tract. Women are affected, and with increase in age and in postmenopausal group, the infection occurrence increases. And what is the reason for this high occurrence of UTI in women? The reason is, number one, it is the women have a short urethra, and the close proximity of the vagina and the anus, which harbor organisms, which can very easily go across and reach the urethra, travel easily, and cause urinary infection. So in a woman, being a woman is a risk factor, and using the contraceptive devices like diaphragm, all these things are make her vulnerable. And there is that particular P1 blood group, and all these people are likely to have urinary infection. And particularly in the postmenopausal group, it is a hormone deficiency which causes the atrophic changes in the urethra, vagina, which is the reason for this. So urinary infection is a spectrum. It can affect the lower urinary tract, presenting as cystitis or urethritis, or affect the upper tract and present as pyelonephritis. Sometimes it can even be asymptomatic. So depending upon the symptoms, say the patient with the simple uncomplicated cystitis will have frequency, urgency, all those symptoms. A simple urinary test, urine cultures, and treatment with antibiotics, fluid therapy will help. But if a woman has upper tract urinary infection, they will have fever, chills, flank pain, vomiting, all those the worst symptoms of sepsis, and they need aggressive treatment. How do we, what are the organisms they cause it? The E. coli is the most common one. All other organisms form less contribution. So the mode of infection is ascending, hematogenous, or lymphatic spread. So this is how easily the organism gain access and how it spreads and causes the infection. So the most important thing is not immediately doing CT scan. First, one has to do a urine test, urine culture, basic test before proceeding further. So what is recurrent urinary infection? If in the last 6 months, if there are a culture proven urinary infection, if there are more than 3 episodes in a year or more than twice in 6 months, it should be considered as recurrent infection. So it's important to consider the good bladder habits. You need to take minimum 6 to 8 glasses of water in 24 hours. So if those who have incontinence, they will just imagine that if they decrease the fluid intake, then the leakage will be less. So if you decrease your intake, the more concentrated urine will get formed, and that will irritate the bladder and further will worsen the symptoms. So, ladies and gentlemen, remember to take minimum 2 liters per day unless the person has a cardiac failure or a renal failure. Otherwise, so for somebody who is an athlete would need more liquid intake, depending upon the weather also. In summer, we will need more fluid intake. So you need to increase your fluid intake as well as frequently empty your bladder. So those who have incontinence, they should restrict their fluid intake before going to bed, particularly for those who have to get up many times to pass urine. Similarly, avoid taking caffeine and the carbonated beverages before activity. If you're going to gym to work out, then it's better to withhold it before going to exercise. And then the general, the recommendation, decrease the caffeine intake, reduce the carbonated beverages, alcohol, you know, how it produces polyuria and other problem. And there is a special diet like spicy food, oranges, tomatoes, they all cause, they act like a bladder irritant. It's better to avoid if you have symptoms. So when
Doctor,
passing,
a quick time check. Sorry to intervene. A quick
yeah,
time check.
I'm going to finish it. Okay. So one need to relax and pass urine completely, and you should avoid infrequent voiding, and you should also avoid passing urine just in case. So maintaining good bowel habits is important. Constipation can further worsen it. So the hygiene part, you just clean it from the front to back. That is important. Doing weight loss is important, and the bladder is the window to the soul. So the exercise is, there are two exercises. One is bladder training, suppressing the urge to pass urine. That is the bladder training. First, you try it for 15 minutes, suppress it. Then next week, you try it for postponing it for 30 minutes. Like that, you can prolong it. So bladder is an involuntary organ like heart, but bladder can be trained. That is very important. The next exercise is the Kegels exercise. And that is you just train the muscles, which are like a hammock and supporting this. So this is very important. You need to continue this exercise lifelong. I would conclude by saying that six men give a doctor less to do than one woman. Ladies and gentlemen, we talked about one, vaccination, two, exercise, and three problems. And do remember about the vaccination and my appeal to you in order to prevent and recognize cancer cervix, and the two exercises to take a whole urine in overactive bladder and in stress urinary incontinence. And I'll be happy to answer your questions. And beyond these three, what is that? The fourth one is there is a questionnaire survey, and you will be given a link. And I request you to spare a few minutes to answer the questions. That will help us to know where exactly we stand. Thank you very much. Over to the chairpersons.
Thank you, Doctor. That was a real wonderful informative presentation, Doctor. Thank you so much for that. The details of the doctor is going to be mentioned in the chat box. So if there is any queries, you can reach out to the doctor for any clarifications. Would request the participants to post your questions in the chat box, and it will be answered during the Q&A session. Okay, so it's again time to thank the participating clubs and their presidents. We have Rotary Club of Diamond City Queens, President Rotarian KG Aarti Anand, Rotary Club of Chennai Madavaram, Rotarian Jayanti Nagarajan, Rotary Club of Teni Metro Kings, Rotarian Narmada Vijay Kumar, Rotary Club of Tiruchirappalli Shakti, Rotarian Valarmati, Rotary Club of Madurai Blossom, Rotarian Sri Lakshmi, Rotary Club of Trivandrum Central, Dr. Shilpa, Innerwheel Club of Gindi, Ambali Nandagopal, Rotary Club of Chennai Velachery, Rotarian Mehanathan, Rotary Club of Chennai Utsav, Rotarian Prem Mohini. Thank you. Thanks for the participating clubs and their presidents.
Thank you, Nagalakshmi.
Yeah, MC Nagalakshmi, I would like to present a souvenir to Dr. N. Rajamaheshwari, so which will be couriered to her. Ma'am, a small memento from us. So this is a Silver Jubilee stand. So this we will courier it to you. Thank you, ma'am.
Thank you, President. Now I request Ann Lakshmi Ramanathan to introduce our honorable guest, Dr. Pavitra.
Good evening, everyone. I would like to introduce Dr. Pavitra Ramakrishnan. She is a consultant obstetrician and a gynecologist of Chennai. She practices at Sri Sharada Clinic, Adayar. She is associated with Apollo, Malar, and Beeble Hospitals, Chennai. She is a panel doctor to India Turns Pink, an NGO fighting against breast cancer. She has totally screened around 10,000 women for breast cancer and has done 200 free breast surgeries till date. Apart from conducting free medical camps for many NGOs, she is highly respectable panelist in many television channels, for having given some very informative talks and interviews on health-related topics. Her main motto in life is to serve adolescents and the menopausal women. And what does she do when she isn't working? Well, she follows a passion of singing. Yes, ladies and gentlemen, she's also a playback singer and was conferred the Kannadasan Award for the Best Debut Female Singer 2009. I call upon Dr. Pavitra to deliver a speech.
Yes. Thank you very much. Thanks a lot for the beautiful introduction. Yes. Thank you once again, the Rotary Club of Guindy, for having me here amongst the so many people out there. And my pranams to my seniors, Dr. Rajamaheshwari ma'am and Dr. Meenakshi ma'am. Hello all. How are you all today? Am I audible? Yes. Thumbs up. Yes. Today is a very beautiful day. We are going to discuss a lot on menstruation. So what's menstruation? Everybody keeps talking about menses. What is it all about? It's the cyclic changes what happens in a normal woman. It is usually, it takes around 28 to 32 days cycle. Okay, usually it is 28 to 32, and it shouldn't go further, or it shouldn't just, pop into 15 days or 10 days. It shouldn't be bad though. If it is more, it is a problem. If it is less, definitely it is a problem. You have to seek a doctor soon. So what exactly happens in menstrual history? What undergoes in your, what all physiological changes your body undergoes is my topic for the day. So there's something called hypothalamus in the brain. And there's something called pituitary gland in the brain. I think I'm able to share the screen. Can the host please allow me to share? It says I shouldn't share or something. I cannot.
Yeah, ma'am, probably you're not. Yeah, I think you're able to do that.
Yes, yes. Is everybody able to see this? This
Yes,
is something
it's
called
visible.
Yes, sir. Thank you very much, sir. So this is something called hypothalamus, and this is the brain, actually, a cut section of the brain. And there's something called pituitary is also mentioned from the further down. So those two are the main what to say, the karma of this one menstruation. So there are two phases of one second. There are two phases of menstruation. One is the proliferative phase and the other one is the secretory phase. So what is proliferative phase? 1 minute. I'll share something else, which is very nice. I took it from my textbook. You know what? I started hunting my textbook and everything. I'm sorry, I had to. Yes. So yes, this is this is a picture of the endometrium. What exactly happens? 28 day cycle, as I earlierly told, this is the HPO, hypothalamo pituitary ovarian action. There are two things which actually a woman needs, two hormones. One is the estrogen and the other one is the progesterone. Everybody knows about it. You just Google it, you come to know about it. The estrogen will proliferate the endometrium and the progesterone will secrete the endometrium. So yeah, so how does it proliferate and how does it secrete? So what actually happens? The endometrium starts shedding down. Okay, the endometrium starts shedding down. The thickness of the endometrium and the uterine lining. If it is visible here, there are two things which are mentioned. One is the LH and the other one is the FSH. What is LH? The luteinizing hormone. And FSH is the follicular stimulating hormone. These two hormones are secreted by the anterior pituitary. We have something called anterior and the posterior. So anterior pituitary secretes the follicular stimulating hormone, which will take place between the 11th day to the 14th day. Okay, so follicular stimulating hormone is what you have, the follicles which are being stimulated by the ovary. Your ovary at the puberty will have, before puberty, that is the children, when the girl is born as a child, the girl will have plenty of follicles, about 1 million of follicles inside her ovary. At puberty, she'll have around 400 to 500 of the follicles. And during her menstrual cycle, each and every follicle just get ovulated. They they actually form a big size of a round egg. They form as an egg, and then they get ovulated. And that's what is happening. The follicle stimulating hormone is being secreted, and the gonadotrophins will ovulate during your ovulatory cycle. And then comes the progesterone. The progesteronic phase, that is, the other one is here. I'm sorry, I sometimes I have to just do this. So the progesteronic phase is when you start secreting. I think it's here. This is what I wanted to show you.
Dr. Pavitra, I just
Yes,
want to
sir.
make an announcement. Friends, just hold on. After Dr. Pavitra speaks, we have Dr. Meenakshi, who is going to talk about Menstrual Cup. So we will wait for Dr. Pavitra to finish. Thank you.
Yeah, I'll be finishing it off in a jiffy. No, don't worry, because I was given only 2 to 5 minutes time. Anyways, so this is the endometrium shedding phase and the ovulation phase, what I was all talking about. The first day to 14th day is the ovulation. From the 14th day, you will start ovulating. That is, the eggs will get released. And if in case the patient or the girl gets pregnant, then the baby is grown inside the bed. And after around 20 days or 25 days, you will start shedding of the endometrium, where you call it as menstruation. And in case you have any kind of changes in these cycles, then you will have delayed periods. Or if in case you don't ovulate, that is called an anovulation period, then you will have probably you will have a delayed menstrual cycles. So usually these menstrual cycles are also affected by two sex hormones, that is estrogen and progesterone, and also the gonadotrophins, which are like the thyroid hormones and the adrenal hormones. These thyroid hormones and adrenal hormones also affect. That's why people, the gynecologist, when they go in, when they ask you, were you stressed this time, it's all because of the stress which you underwent, and that's why you didn't get your probably you didn't get your cycles. Or they will ask you to repeatedly check on your thyroid levels, and these two are the main hormones which hit the menstrual cycles. So I think it's getting into a lot of detail. I think I'll end up my speech here. So thank you very much for the great opportunity, and thank you all for your patient listening. Over to you, MC.
Thank you, Doctor. That was a wonderful and informative talk. Now I thank the participating other clubs. Rotary Club of Chennai Utsav, Rotarian Prem Mohini, Rotary Club of Chennai Sunrise, Rotarian Vidya, Rotary Club of Chennai Tiruvannur, Rotarian Sharda Ramani, Rotary Club of Chennai Spotlights, Rotarian Jayanti Karthikeyan, Innovil Club of Chennai Symphony, Rotarian Kavita Srinivasan, Rotary Club of Karak, Rotarian Gajavan Mani, Rotary Club of Nagarkovil, Rotarian Jayachinda Dharma DG, Rotary Club of Ahmednagar Priyadarshi, Rotarian Vindi Srishat, Rotary Club of Nagpur, Rotarian Dr. Shantala Bole. Now I call upon Anne Janaki Venugopal to introduce the most vital guest, Dr. Meenakshi, who is going to explain about the menstrual.
A very good evening, ladies and gentlemen. It's my honor and privilege to introduce our keynote speaker for the evening. She is a multifaceted personality, and it is not often that you find a medical professional profoundly committed to waste management. She is Dr. Meenakshi Bharat. She is not only a gynecologist and fertility specialist, but she's also a green campaigner, an advocate for Clean India, a strident voice for garbage segregation and reduction and recycling. A gynecologist for 35 years and a fertility specialist for a quarter of a century now, her medical practice mainly consisted of treating people with irregular periods, PCOS, and making it as comfortable and stress-free as possible. She was propelled into waste management when her daughter caught dengue in 2007. Prevention is better than cure has always been her mantra. And knowing that garbage produces so many diseases made her take up this not so glamorous task. Garbage segregation is not difficult, and she loves to demonstrate how all of us segregate everything in our lives except garbage. From garbage segregation to composting, to growing veggies on her terrace, to having a garbage-free wedding for her children, she has done all that one can do individually to spread this message. Having now retired from active medical practice, she wants to spend her time spreading the message of creating as little garbage as possible. She is a Rotarian from the Rotary Club of Bangalore West, District 3190, and a member of the Inner Wheel, Bangalore West. Her current project is Green the Red campaign, advocating the use of sustainable menstrual products, a solution that makes the life of women very happy during this sometimes stressful period every month. Her mantra is no rash, no trash, and no cash. Here she has brought about a natural fusion of her two loves, gynecology and garbage management, in this platform. She has been influenced greatly by the Indian independent activist and social leader late Jayaprakash Narayan. Dr. Meenakshi believes that youth can make the best difference to the country. Be informed, be proactive, be involved, says Dr. Meenakshi Bharat. And to elucidate further and to educate this august gathering, over to Dr. Meenakshi Bharat.
Thank you very much, Janki, for this wonderful description. I would like to share the screen. So like Janki said, my passion is to make women happy during their periods. I miss this opportunity for myself, but I don't want any other woman in the world to miss this opportunity. And as many as I can impact, I'll be happy to do that. And Rotary has given me this unique opportunity of talking to people across the world. The Rotary Action Group is wonderful. Right, so what we're going to do is talk about clock pads and menstrual cup. We are going to talk about why we need to impact the women in India. We're going to tell you how long does it take? 5 days a month, 65 days a year, and 2,500 days in our lifetime. That's what we spend having periods. And that is a lot of time. We only look at one period at a time, so we don't see the cumulative effect of it. So the pads evolved like this, from these pads that I used in the 1970s to this very, thin pad with a plastic cover, and we didn't realize what was going into these pads. It's a story of plastics, and National Geographic has said that 95% of our pads and tampons are made out of plastic. We think they're convenient, but actually this is the reality. It smells, it's made of plastic, cannot be recycled, cannot be reused, and clogs the drains. The impact on health is fabulous or disastrous, whichever way you want to look at it. The dioxins and furans, the pesticides, what is there is actually, making us very, very sick. We don't realize it's small quantities, but cumulatively it does. Imagine your car tire, styrene, is part of your pad. Did you ever think that that would be a possibility? The effects of the pads and the tampons, all of us know, all of us really dread the periods coming, because we are so uncomfortable for those 4 or 5 days. Or if you are unfortunate to have a 7-day period, then you are all the more miserable. Very little studies have been done. If you look at it, this is such an important aspect for women, but very little work has been done on this. We hope to churn out lots of articles in the coming next 10 years, and we hope to actually prove that using sustainable products will reduce the amount of cervical cancer. And that is a challenge that I will put to Dr. Raja Maheshwari. her presentation was so wonderful. Toxic shock syndrome is something that happens with tampons. It doesn't happen with the menstrual cup. All right. If you look at the comparative health analysis between disposable pads, cloth pads, and menstrual cup, the menstrual cup by far wins the race because it is so comfortable. You even forget your periods. That beautiful it is. So we need to, all of us who are here, need to begin to use the menstrual cup. Disposable is a big problem. Disposal is a big problem, and burning is not the solution. We all must stop giving incinerators. We must stop giving disposable sanitary napkins. And as Rotary, we need to take this message across. Don't set up pad dispensing machines. Don't set up incinerators, and don't give disposable pads. You're wasting your money. There are better things that you can do, and you can have greater impact. Big bang for your money. Economics is here. Period poverty is a sad state of affairs where women don't have money to buy supposedly hygienic products. Single-use disposables over the last 50 years has been touted so much that we think that only if we use single-use disposables are we having a hygienic period. Wrong. We have not used, we have, so much money is there in this that they advertise and get the most, glamorous women and men to talk about it and say, periods, use disposables. All right. So compare this analysis. A single disposable pad costs you between 2 and 8 rupees. A menstrual cup, the best menstrual cups cost about 1,000 rupees. But if you divide 1,000 rupees by the 10 years that you can use, it's 100 rupees a year, less than 10 rupees per period. You can't get anything more economical than that. You can't find anything more comfortable than that. And it is just fabulous. So women who are married are the low-hanging fruit. You need to start using this and figure out that your periods are no more trouble. For the younger girls, between the beginning of menarche and 18, 20 years or till they get married, they can use the cloth pad. The cloth pad has come in its new avatar and it is wonderful. All right. Impact on the environment. Every pad we throw within 6 to 8 hours. And cumulatively, it produces so many kgs of waste. Bangalore produces 100,000 kgs of waste a day. Chennai must be producing more than that because it's a bigger population. All right. What happens to the waste disposal issues? It goes to the open dump. It is mixed waste. It is burned. It blocks the drains. Every apartment, every school, every, factory, every building which is there, which has lots of women there, they throw the pad into the sewage system and it bloats and blocks the drain. So this is something, and it's not only this, this is about 5% of the total garbage that we produce. So every single-use disposable that you use, you will create garbage. So go back to the original thing. See, this glass is the original copper glass. If you go back to the copper glass, go back to the steel, go back to the reusables. Don't use any disposable. It's even wrong. In the corona time, we should not be using any disposables because we are passing our infection to the person who picks up the garbage. So the old practice of drinking from above where there was no juta is what we need to reinculcate in all of us. Then we will not be spreading the corona the way it is spreading now. All right. What's the impact on the sanitation and health workers there? Completely a problem. All right. So what are the sustainable solutions? The two solutions, like I said, for the younger girls, it is the cloth pad. Now, cloth pad, all of you will turn on and say, chi, it's not good. All the not good factors of the cloth pad has now been removed, worked on, and I can tell you it is so comfortable. My children have all used it and they vouch for it. If you have young girls, please give them the cloth pad and they will love it. Teach them how to clean it. That is all that is needed. The menstrual cup is the most wonderful solution that is available for periods, and each of you need to use it. So between menarche and 18 to 20 years, when the girl child has now become an adult and she can make an adult decision, she can then shift to the menstrual cup. Or if you're married, you don't have to worry about it. You can shift to the menstrual cup without any hassles. Solution one is cloth pads, very nicely done, can be made locally by you people. It only has this leak-proof material at the back, which is the innovation. The leak-proof material is what prevents the blood from staining. Now this pad can absorb 5 ml of blood that this pad absorbs. So capacity of the cloth pad is the same as that of the disposable sanitary napkin. So it's no less, and it can be washed very easily without any problems. Just soak it in half a mug of water for 10 to 15 minutes, then squeeze all the blood out, let it go into the drain, either wash it by hand or wash it by the washing machine, and put it out in the sun. The sun is the best sterilizer. So you don't need anything else. You don't need any chemicals. Just wash it with a little bit of soap and put it out, and you will find that your pads are nice and crisp and ready to use tomorrow morning. If it's raining, then hang it on a hanger and dry it within your room where the fan is going, or wherever it is. Dry weather will actually just dry it up by the next morning. So 5 pads is all that is required. You can wash it, reuse it, and it will be enough for a girl for her periods. Menstrual cup is the new solution, though not new. It was invented in 1937, but it has come into the market in the last 10 years. And I regret, I wish I was younger, I could have used this, but I didn't get to know it in time before my menopause. All right. It's made of platinum cured medical grade silicone and is similar to all the stents, all the catheters that we use. So it is foolproof. There's no problem with using this. It only collects the blood. It doesn't do anything else. So it sits in the vagina. It sits in the vagina and collects the blood, and the blood just goes inside it and stays there. And this has a capacity of 20 to 23 ml. So one word, then you will say, doctor, how much do I bleed during my periods? Ganga, Jamuna, Kaveri? No, all you bleed is 60 ml, which is a peg measure. All you men who are around, you know what is a peg measure. And that is about all that we bleed during our period. So this cup holds 23 ml. Capacity is fabulous. So you need to change it once in 12 hours. That's where it is sitting. And this is a dead end. The cup cannot go up the cervical canal. It just stays here and it cannot vanish anywhere. So don't get worried when you are wearing it. All right. Tampon users can use it without any problems. The menstrual cup just stays in the vagina. All right. How do you insert it? Wow, this looks like such a big thing. How can I put it inside? If I turn it around, that is what goes inside when you have intercourse. So this is not truly very big. And if you want to reduce the diameter, you punch it down, put a little lubricant on it, and allow it to go inside. The learning curve is 3 to 10 days maximum out of your lifetime of 2,500 days that you're going to have your periods. The learning curve is only 3 to 10 days. You can definitely try it. It's worth trying it. It's just the best thing in life. All right. So how to clean it? The next question is, how do I clean it? Do I boil it? Do I sterilize it? Do I put it into the microwave? No. Remember, when you have intercourse, you're not sterilizing anything. You're allowing the act of intercourse to happen without any cleaning measures. It is so comfortable. Don't forget to remove the cup at the end of the period. And once in 12 hours, you have to remove it and wash it and put it back again. So it's completely wash and wear. What are the advantages? You can very clean, you don't feel yucky, there is no feeling of wetness, no white discharge, saves a lot of money, no trash, you don't even have to wear your underwear. In the hot weather, no underwear is necessary. It reduces the abdominal cramps. You don't need to remove it to pass urine or stools, less frequent removals. You don't have to worry about in the rain. When Madras floods happened in 2010 or 2014, I can't remember, people were sending disposable sanitary napkins. It was pouring cats and dogs. I wanted to tell everybody, send them the menstrual cup. They will learn about it in double quick time, and they will use it, and it will be perfectly good. When the floods happened in Wayanad, disposable sanitary napkins were sent, and periods will come. Irrespective of what the tragedy is, periods will still come. And all the pads floated down and landed up in the Alapi district. And they were really distraught with seeing all those stained pads. So it's not affected by rain, doesn't feel like you're wearing anything, and you can do everything. And everyone, from the sophisticated actress to the simple villager, everybody can use it without any difficulty. What are the frequently asked questions? What is the difference between sterility and hygiene? Hygiene means that you are keeping something clean, but you're not getting rid of all the bacteria, all the viruses that are there. It's just cleanliness. And all that requires for this cup is hygiene, not sterility. You don't want to get rid of all the bacteria. The body, our body consists of 100 different varieties of bacteria, which is necessary for us to function. If the food we eat needs to be digested, it is bacteria in our gastrointestinal tract. If our mouth should not be stinking, it's because there is good bacteria in the mouth, which is keeping our mouth clean. If the vagina needs to be clean, it is because the vagina is teeming with bacteria. It's an unsterile area, it's teeming with bacteria, and when we have intercourse, we don't sterilize anything. So we don't need sterility, we just need hygiene. All right, so the non-sterile parts of our body are the mouth, the nose, the ears, the rectum, the vagina, and the lower part of the urethra, just the lower 1 centimeter of the urethra out of the 4 centimeters. All the rest is sterile, but these 6 places are non-sterile. All right, who should use the cup? Many women will turn around and ask me, can I introduce it to my daughter? Now, please introduce it to yourself first. You are the low-hanging fruit. You should use it, and once you are comfortable, yes, you can introduce it to your daughter. But don't think of other people. I am asking you to use this because it is the most wonderful thing. You need to use it. Why must you miss out on it? It's like having a smartphone. This is the smart solution for your periods. You need to use it, and you need to experience it, and you need to have a totally trouble-free period. All right. Scared of inserting. Oh my God, this is so big. It is as big as a Nimbo. How will I put it in? But when you deliver, you remember your baby's head is that of a coconut that comes out. If a coconut-sized head can come out, you can insert a Nimbu-sized object inside. And then I said, if you reduce it and make it a punch down, it is now a groundnut-sized thing that is going inside. It opens up in the vagina and it forms a wonderful seal, and you don't feel any wetness when you're having the period. All right. So can a virgin can an unmarried girl use it? You know what it is? The hymen is a small little piece of tissue that is 1 centimeter by 1 centimeter, nothing more than that. And it's like a rubber band. And the rubber band, like it is, has a hole in it because you are going to, bleed, and that blood is coming out. It's not, what is it called? The hymen, which is without a hole. So hymen will expand when you put in a cup and will come back again. So yes, if the girl at 18 years makes the choice to use it, yes, you can. If you are a cup user as the mother and your 13-year-old or 14-year-old wants to use it, then yes, you can handhold her and allow her the opportunity to use it. But it must be her choice. And remember, as a community, we have this notion that, we want all our girls to be virgins. The hymen never ruptures, so don't worry about it. It just stretches a little more. So if you're cycling, if you're playing basketball, if you're running, the hymen becomes little elastic. All right. So how much blood? I've already told you about that. The menstrual cup holds between 15 and 23 ml, and you can empty this cup depending upon your experience. So start with emptying it once in 4 to 6 hours. And if the cup is only half full or less than half full, you can allow it to go for longer time. But once in 12 hours, you must remove it. You must empty it. You must wash it. Now, this cup is made of medical grade silicone and it is very soft. So no bacteria grows on this. Unlike the tampon, where is the tampon? Unlike the tampon, which has got cellulose in it, the cellulose acts as a growth medium. Now remember, Dr. Raj Maheshwari said that we need to culture the urine and it takes 48 hours to culture. Now, if we remove this cup once in 12 hours, then the vagina will not have time to grow. So therefore, you will not get infection. All right. Is it good for heavy periods? It's very good for heavy periods because remember, the capacity of a pad is 5 ml. The sanitary napkin. All right. Individualized changing, it depends upon you. How much namak you put into your khana is an individual thing. The same way, I can't tell you when you need to remove it. You will learn to do it once you have started using it, and it's wonderful. All right. Can one use it when one is wearing a copper tee? Yes, you can. This does not have enough capacity to pull the copper tee out. All right. These are all myths. Urinary tract infection. Yes, you may get urinary tract infection the first time that you use it. But remember, you need to wash your hand. You need to wash this. And then you need to put the cup inside. Don't put sterile things onto your hand to sterilize your hand. Just wash it with plain water. Now, this is acidic. The vagina is acidic. And soap, if you put and wash this cup, then the soap studs remain and it changes the milieu because soap is alkaline and this is acidic. Then the good bacteria get displaced and the bad bacteria come in, and then you blame the cup. The cup is like the daughter-in-law. Anything that happens in the family, the daughter-in-law is blamed. It could possibly happen even before the daughter-in-law came into the house. So the cup you use and you have urinary tract infection, you have something else, you have stomach pain because you ate pani puri, blame the cup, right? So don't do that, all right? Okay, the cervix is a one-way road. Even if you're sleeping, the comfort is that you can sleep in any direction. The blood in the cup will not go back into the uterine cavity. All right. Now, when you start using the cup, it's a private affair. Neither your dog nor your mother-in-law knows you're having periods. The pharmacy chap doesn't know, and the waste picker who comes to your house doesn't know that you're having your periods, because this is all that is there and you're going to use it for 10 years. All right. The nice part of it is there's going to be no stink in your bathroom. also. Otherwise, we all had stinky bathrooms, and the poor husbands used to suffer because they used to use the same bathroom as the wife or me. So the dog doesn't know that you're having periods because it doesn't smell the blood anymore. So in conclusion, what is your role? To shift to sustainable menstruation, it starts with you. Rotary is taking it up in a big way. All Rotarians must use it first. Charity begins at home. Before you talk about it to anybody else, you must experience it. Once you experience it, you will be able to talk about it. You'll turn around and say, Dr. Meenakshi, didn't you tell me you're menopausal and you didn't get to use this cup? I did get to use this cup because I wanted to know how it feels. And I used it for 6 hours. I put it inside and I did yoga. And I used it for 6 hours and it was like not wearing anything. That's when I said, I wish I was 20 and I had this solution available for periods. But what to do? I can't change my age. All right, we need to change the attitudes towards menstruation, remove the shame associated with it. So what Dr. Pavitra explained is what we need to explain to our girls, teachers, women, so that they talk to their girls as they get to 8 years, 10 years, and they know that the period is going to come. So then no child is going to commit suicide because her dress got stained. And that was something that happened to a to a Tamil Nadu girl a few years ago. All right. We need to talk to all our relatives, friends, peers, everybody, and counsel them about this wonderful product. Now you will ask me, why is there no advertisement about it? The most expensive cup is 1,200 rupees. And if that is all that the manufacturer is going to get, where is the money to make an advertisement for 3 crores or 4 crores? The disposable pad making industry is a 17,000 crore industry. Naturally, then they have the ability to choose the best film stars at 3 crores to do an advertisement and put it up. We don't need advertisements. We need you to use it and we need you to spread the message. So therefore, there is no need for advertisements. Word of mouth is the best advertisement. All right. So shift to sustainable menstruation. It is total independence from period problems. You save 90% of the money that you would spend on the supposedly hygienic single-use disposable sanitary napkins, and you avoid 95% of the wastage. Why must you not take up this wonderful thing? No rash, no cash, no trash. All right. So how do you spread the word? Put it up on social media, talk to every woman. Dr. Pavitra did a wonderful Facebook Live yesterday and shout it from the rooftops. Our project is Green the Red. And as you can see, my sari is more green than red because all of you are going to use this product and take it up. I always wear a green and red sari whenever I'm talking about this wonderful solution for periods. So we have a website called greenthered.in. You need to go there and see all the information that is available for you. Influence government and NGOs, stop investing in pad dispensing machines and incinerators. Use this opportunity of wash in schools to spread the message and provide reusable cloth pads to all the interactors, to all the schools that you go to. We have wonderful programs where it can be locally stitched. So do come back to us, do come back to Nisha Bellare. There are hundreds of women around the country who are stitching cloth pads, which are worth it. One of the first cloth pads was what was made in Pondicherry, which is called EcoFem, and that was 10 years ago. So they are also making it, it's economical and worth it. All right, gift it to everybody. Every wedding that I go to, like this girl's wedding that I went to, I gifted it to her. So that's my only gift. I don't give any other gift. Gift it to all the people who work for you. If they work for you and they have comfortable periods, then they will do a fabulous job. This whole lot of 25 women, we gifted them this thing at the during Diwali last year, and they all love it. Every time I meet them, there's a big smile because they are so comfortable during their periods, and no rash, no trash, and no cash. So this is what all of us need to do. First you use it, then you tell everybody to use it, and every opportunity. You can get it for 350 bucks, you can get it for 500 bucks, you can get it for 900 bucks. Remember that when you buy a cotton sari, you will buy between the nylon sari and the cotton sari is more comfortable, but the cotton sari is more expensive than the nylon sari. So don't go in for cheap makes, go in for the makes that are made in India. And the made in India has a chapo on the cup, which is not renamed for an Indian market. So there are few products that are made in India. Go to Amazon, 99 varieties of products. How do you choose? Choose a made in India product and choose a moderately expensive one. 900 rupees divided by 10 years, 90 rupees in a year, and less than 10 rupees in a month. You can't get anything better than that. Use the menstrual cup. Thank you very much for giving me this wonderful opportunity to talk to you all about the goodness of the menstrual cup. Please take it up. By the time I come to talk to you next month, you should have bought it, used it, and given us feedback. Give Vidya the feedback because she is your local champion. Thank you very much, sir, for giving me the opportunity to add to the wonderful lectures that both Dr. Raj, I'm presuming that you think that my lecture is good. Dr. Raj Maheshwari gave a fabulous lecture. Dr. Pavitra gave a very nice talk. Thank you.
Thank you, ma'am. Thank you.
Thank you, Doctor, for changing our. Thank you, Doctor, for changing our mind towards a new trend. That's a wonderful speech. Thank you, District First Lady Kamala, for your enthusiastic participation. Thank you, District officials, for giving us support with your cheerful presence. Participants, please wait. We have a doubt clearing session. I request Rotarian Dr. Anuradha to take over the question answer session. Over to Dr. Anuradha.
Thank you, Suja. And good evening, everyone. It's really a wonderful session. I like to ask Meenakshi ma'am and Raji ma'am. I think Dr. Pavitra informed me that she want to go to OP and she left. So I take over the question session to Raji ma'am and Meenakshi ma'am. And most of the questions has been answered already by Meenakshi ma'am. It's very crystal clear because merely she covered 23 questions answers. So anyhow, I don't need to cover those things. Already we are backing up at the other question. So first question to Dr. Meenakshi ma'am. It's a question from Narmada from Teni Metro Kings. How does a menstrual cup differ from a tampon?
The menstrual cup is made of medical grade silicone. The tampon is made of the same material as your pads are made of, and they are disposable. They absorb the blood. This only holds the blood. This does not change the blood in any way. The blood gets absorbed by the tampon and the tampon swells inside your vagina. But the cup does not do anything like that. The cups, some of them have a stem and there are stemless cups. Both are good. The stem is just for you to feel the cup inside the vagina. Once you have seen the cup, you have to go beyond it, pinch it, and then pull it out. You can't just pull it out like that. This tampon is disposable, is made of cellulose, and if you forget it, then the bacteria can grow on it because there is medium. So why do pads stink? Pads stink because they are made of cellulose, and the blood that comes down from the vagina comes down with the bacteria that is there in the vagina. Hundreds and thousands of bacteria that is there in the vagina. It comes down with the blood and then grows on the pad, and when it grows, it produces the stink. So therefore, the difference between the cup and this is that there is nothing that is growing inside it. It is just a receptacle to collect your blood.
Thank you, ma'am. Thank you. I think Namata ma'am might have get the answer by this now. And next question is again the same question, ma'am. Age limit for using menstrual cup. I think you answered it. So it's a question from Aarti Anand from Trichy Diamond City Queens.
Age limit, there's no age limit. You can start at any point, but I need the mothers to use it before the daughters start. And you use it from the time you are 18, 20 to the time you become menopausal.
Thank you, ma'am.
3 cups in those 30 years. As against 1,800 into 3, 5,200 pads. What a difference.
Thank you, ma'am. Thank you so much. And the next question is from Bindu, Ahmedabad Priyadarshini Club. The question is a menstrual cup safe to use in case of uterine fibroids or with IUD in place?
I showed you the IUD. It makes no difference to the IUD. It makes no difference to the fibroid. It makes no difference to the endometriosis. It makes no difference to the polycystic ovaries. All that the cup is doing is sitting in the vagina and collecting the blood that would normally come out. If you're not wearing a cup, the pad is sitting here. When you're sleeping in the night, you're sleeping like this, the blood collects. And when you get up in the morning, there is a rush of blood. When you're wearing the cup, there is no gush of blood at all. And when you remove it, there may be half a cup of blood in it.
Thank
Did
you,
I
ma'am.
answer your question?
Yeah. Next question is from Sri Lakshmi. How often it is ideal to empty the cup? I think you also answered this. Again, one word.
Between 4, 6, 8, 10, but you must do it once in 12 hours.
12 hours. Okay. Ma'am, next question is from the same person, Sri Lakshmi. What is the recommendation to handle leak if there is an overflow and if you are in a situation not to be empty?
So I said no, 12 hours you can use it. So if there is a leak, usually there are holes here. The leak will be only a serous fluid. It will be a small leak and it will happen only to wet your panty. It won't stain your clothes because the serous leak is the blood all settles down here and it's only the liquid of the blood that comes out. So the leaking is definitely 95% not there.
Thank you, ma'am.
Again, you use it and you realize it.
Yeah,
I'm sitting all right, then you don't have any problems.
Yes, ma'am, that is true. The people who are using, they know the benefits. Since I'm using for a past decade, I'm really happy with this. And the next question is from Sri Lakshmi, Madurai Blossom. The question is, what is the best practice of cleaning the cup? What material or what liquid we should use to clean the cups?
Plain water. I told you, if you use the soap, if little bit of the soap is left on the cup, then it will change the milieu of the vagina, which is acidic. It will become alkaline, and then you will land up with infection. So just wash it with plain water. Remember, I told you, you don't wash your husband with any chemical before allowing him inside. You cannot use it immediately after delivery because that coconut-sized head has come out and therefore the vagina is loose. Post-delivery, if you've had a normal delivery, you will have to use cloth pads. Post-delivery, if it's a cesarean section, you may use it, but usually post-delivery, this cup will not hold the amount of blood that's coming out post-delivery because you have lots of blood coming out post-delivery because the placenta area is quite big.
Thank you, ma'am. Thank you. And there is a question from two people, the same question. Which cloth pad brands you recommend for the teenagers? It's from Isha and from Shantala from Nagpur Club.
There are many cloth pads that are available. You have to try it out. We are, making Rotary do the cloth pads about 400 rupees for a set that will last you 2.5 to 3 years. You can use those. Go to the greenthered.in website and you will find many varieties. All right. And the other thing that where do you keep the cup? between periods. Wash the cup, dry it in the sun, and then put it into a nice box and keep it with your jewelry. Or you put it into a pouch like this and carry it in your purse. That's all that you need to carry. So remember, more important, your cup is more important than your jewelry. This is to show everybody. This is for you to use.
Good one, ma'am. And next question is from Narmada. Can I wear a menstrual cup when I swim?
Of course, I told you that. That is one of the biggest advantages. You can do everything: swimming, trekking, walking, cycling, going up the Himalayas. You can do that.
Yes. Thank you, ma'am. Thank you, ma'am. And thank you, Meenakshi ma'am, for answering all the questions. Now we'll ask some questions to Dr. Rajamageshwari ma'am.
One last question. I think Anita, I just read it, says, can diabetics use it? Yes, diabetics can use it too. It's just that there is little more glycogen in the vagina. So you may need to remove it once in 6 to 8 hours, wash it with plain water and put it back. It will not increase your chances of having any infection.
Thank you, ma'am. Thank you for the answers. And Raji ma'am, are you ready? Raji ma'am?
Yes, Anuradha.
Yes, ma'am. A person, Pranoti, is asked this question. How helpful is the vaccine for cancer to be taken if someone has undergone miscarriage?
See, it is ideally recommended to have the vaccine before any sexual activity begins. But even if sexual activity has begun and you come to know about the advantages of the vaccine, still you can take the vaccine. That will protect against the virus related infections like warts and other things. So it is up to the age of 45 it can be given. Ideally, it should begin before the sexual activity begins in their life.
Thank you, ma'am. Thank you. These questions are coming from chat box. So I don't know the club name. The next question is from Jayanti, ma'am. Any chance of getting cervical cancer after taking Gardila HPV vaccination?
See, the Gardila, there are several types of vaccine. The latest one is Gardasil 9. This Gardasil 9 covers more number of strains. Unfortunately, Gardasil 9 is not available here to us. What is available is the quadrivalent Gardasil to us. But something is better than nothing. So if there are different types of different strains of the HPV, the organism, then the vaccine that covers more number of strains will be better for us. But in due course, any problem with the vaccine, like even the COVID vaccination, if the organisms undergo mutation, then we may lose the advantage of taking the vaccination. There is always a possibility of acquiring infection with a mutated organism. So that is the reason why even after taking 3 doses of vaccination, one is recommended to undergo the periodical, the pap smear and other things.
Okay, thank you, ma'am. As we are running out of time, I think this will be the last question. As we already displayed Dr. Meenakshi ma'am and Raji ma'am contact number in the chat box, participants can contact them in future reference. So the last question is from across the country. It's from Russia, Marina Maximchuk. She asked, vaccine for cervical cancer, does it offer benefits for already sexually active women?
So even if she's already sexually active, but if there are the chances of she acquiring, say, the warts or the infections or dysplastic changes, that can be prevented by getting yourself vaccinated. Still, there are advantages, but may not be as advantageous as it is given prior to the onset of sexual activity. to the extent even the men are advised to take the vaccine, because men also can they get the HPV associated infections, warts, and other things. So that kind of benefit will always be available.
Okay, ma'am. Thank you, ma'am. And one final question from Pune Sports City. It's in the chat box. I have a doubt if the blood get dry and cloth pad become hard and can hurt skin. How to manage?
Yeah, Dr. Meenakshi said she will answer her personally.
Acha, fine, sir. Fine, sir. Okay. Over to MC. End of question answer session. Thank
Yeah,
you.
we are certainly eager to continue the session, but we're running short of time. I request the participant to interact with doctors personally, and we shared the number already. Okay. Now I
Just a
request
reminder, dear ladies, please note the link given to you and participate in the questionnaire communicated to you.
Sure, ma'am.
Okay.
Also, if you can actually set up a WhatsApp group with all the people who have participated today and add Dr. Raj Maheshwari and me to it and Pavitra, we can have an active group that will handhold all of you through all the problems, especially the shifting to the menstrual cup, and it will help to make you use it much better.
Yeah, Dr. Meenakshi, we have already suggested that.
Thank you. Thank you, Vidya.
Okay. Thank you, Dr. Rajamageshwari and Dr. Meenakshi. Now I request our wonderful District First Lady, Kamala Muthuparniyappan, for the closing note.
President Sharath Kumar, First Lady Nandini, Event Chairman Dr. Anuradha, Club Service Director Kritika Madhu, Speakers of the Day Dr. Meenakshi Bharat, Dr. Raja Mageshwari, Dr. Pavitra, Chief Guest Vidya Srinivasan, ANS, ANATS, Innovil members, Rotarians, Retractors, good evening to all. Rotarian Kritika and Anu have been talking about the need of this awareness meeting, and the planning for this meeting started 2 months ago. Today, the three eminent doctors spoke elaborately the topic related to the menstrual hygiene and the wellness. It's an eye-opener for all of us. Having listened to them in such detail, all women should start using either reusable sanitary pads or the menstrual cups, and also propagate this amongst the community. When it is safe, hygienic, environmental friendly, and also economically affordable, it's only the awareness that matters. Rotary is the great platform to create awareness. Program like this will help in reaching out the communities. We have more than 25 clubs participating in today's meeting, and I feel there cannot be a better forum than this to promote the use of menstrual cups. Our chief guest and AG Vidya Srinivasan is Vice Chairman of Rotary Action Group for Menstrual Health and Hygiene, and her support will also help us to strengthen this initiative. I would like to appreciate the good work done by Rotary Club of Guindy in organizing this meeting. Today, to conclude, I would urge all of you to look at ways and means to engage our respective club fellow Rotarians and ANATs and make them take part in this initiative more proactively. Women's health is nation's wealth. Thank you all.
Thank you, First Lady. Now I call our Secretary Balachandar for the Secretary report.
Yeah, thank you, Suja. Vanakkam அனைவருக்கும். Our Rotarian John Rajesh Reddy celebrating birthday today, and Atvika Anandal, Anat of Srikanth Anandal, celebrate birthday on 19th April, and our Rotarian Sunil Srinath celebrate birthday on 20th April. Thank you. And our next weekly meeting, the details of next weekly meeting will be sent through our official WhatsApp group. Thank you.
Thank you, Rotarian Balachandar. I now request our Rotarian Dr. Anuradha, Chairman of the event, for vote of thanks.
Thank you, Sujata. I, Dr. Anuradha, Chairman of today's Menstrual Hygiene Program. It's a great honor and privilege for me to propose this vote of thanks on this memorable occasion. Let me start my thanks to the Almighty for making today's session a resounding success. First and foremost, I thank our special guest, District First Lady, Mrs. Kamala Muttupalniappan, and AG Vidya Srinivasan, Vice Chairman, Rotary Action Group, Menstrual Health and Hygiene. Thank you, Kamala ma'am and Vidya ma'am, for your presence. My heartfelt thanks to all the district officials, presidents, secretaries, Rotarians, aunts and aunts, Rotaractors, interactors from all the participation clubs, friends and guests across the country. You took up immense effort to take part in this session. So it's a humble thanks and request for everyone to patiently wait till the end of the session. Thank you. And my special thanks to the stars of the event, Dr. Meenakshi ma'am, Dr. Rajamageshwari ma'am, and Dr. Pavitra ma'am, who did the session very well and made it a grand success. I must mention Dr. Meenakshi ma'am for the crystal clear presentation about the topic of the day, and she made the question answer session very easy for me. And Dr. Rajamageshwari ma'am for crystal clear explanation about the 3 steps: vaccination, exercise, and the problems about urogenital problems for the woman. And Pavitra for the clear explanation about what is menstruation. It was a sweet and short information, but really it is important to be shared here. So thank you, Pavitra, for that. And last but not the least, I extend my thanks to Rotary Club President Sharat Kumar, First Lady Nandini, Secretary Balachandar, Club Service Director Kritika Madhu, Community Service Director Dr. Vishnu Srinivas for the guidance, and must show my gratitude to my team members right from the Master of the Ceremony and Nagalakshmi and Sujata Srinivasan, Rotarian Radhakrish for Provatist, and Rajalakshmi for Thought for the Day, and the speaker introduction done by and Janaki Venugopal ma'am, and Sujata ma'am, and Lakshmi, and the technical support done exactly and apt and fabulously by Rotarian Naresh Advani ji and Rotarian Prabhu. I can't end without thanking my family members who were the pillar of me. And finally, I leave you this inspiration quote by Swami Vivekananda: arise, awake, and stop not until goal is achieved. Thank you once again for your patience. Thank you. Over to MC.
Thank you, Dr. Anuradha. We reached the end of the program. Let's all arise for the national anthem.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे.
Thank you all. I'm signing off. This is Sujata Sivaraman. Asij.
Yeah, to Sujata, I would like to adjourn the meet.
Yeah, please.
Yeah. Thank you, doctors. Thank you, everyone, for attending. Dr. Pavitra and Dr. Meenakshi. So this will be sent to your address, a small memento from the Rotary Club of Guindy. Thank you all. This wonderful meet by Rotary Club of Guindy and 25 participating clubs is now adjourned. Thank you.